We're still asking the question, why was Charles Byers, the man who was shot and killed by Chesterfield Police, removed from Chippenham Hospital while under court-ordered mental health treatment just days before the shooting? Richmond police say they arrested Byers at Chippenham last Thursday evening for an alleged assault against a healthcare worker, but they won't give us any details about the assault or answer why they would remove someone in crisis from a psychiatric facility. In a new statement, RPD says, quote, "There is no further information available. An investigation is underway, and then our request for information is in process by their legal affairs." We've now obtained this court record, which notes the nature of the offense as, quote, "Law enforcement officer says he was working at the hospital and made contact with Byers. Officer says Byers has been polite and cooperative following initial contact." After his arrest last Thursday, Byers appeared before a Richmond magistrate, the same office that initially issued him a temporary detention order, which was served that very same day, and the magistrate released Byers back into the community. More than 24 hours later, Byers allegedly broke into people's homes in Chesterfield and was shot and killed by police when officers say he refused to drop a weapon.
When you have someone who's in mental health crisis walking around a public street flailing a hatchet, that's a failed system.
While much is still under investigation, Chesterfield Police Chief Jeffrey Katz says he believes this incident speaks to a broken behavioral health system, which places law enforcement in frustrating positions.
And I see the decline in the capacity of the system and the ability to get people into positions where a practitioner is helping them immediately, or at least close to it. I just see us slipping.
As Byers was in crisis, we know that he interacted with multiple agencies, the court, the hospital, law enforcement, and Katz is pushing for better collaboration and communication between criminal justice and mental health.
We have to figure out how can we integrate those two systems, make sure that we're doing a good job of providing crisis care for people in crisis, but also not giving license to people to go out and harm other people and say, well, I was in crisis.
As for the shooting itself, Katz says he would not talk about specifics, but we did ask if he would release the body cam footage.
I never have released body cam footage. I've always made it available at the conclusion of an investigation for everybody who wants to come in and see it. But I've never released body cam footage, and I'm not going to start. We collect body camera footage for a court of law and not for a court of public opinion, and we're going to continue with that policy.
How does that tie in with public transparency?
Anybody that wants to come in and see the video can come in and see the video.
And there was no way of Chesterfield Police ever knowing his mental health history at the time?
No. No.
And he adds that he stands by the officers involved in that incident. Now, of note, he says just 2 weeks ago, Chesterfield Police launched the Marcus Alert System, which establishes a coordinated response between police and mental health to certain situations. Here in Richmond, I'm Tyler Lane, CBS 6 News.